Hello and welcome everyone. Hi Obi.
Hey, Sophie.
How are you this evening? Hot?
Very.
Oh my gosh, it has literally been incredible this last few weeks, but I'm not going to complain too much because
Yeah.
heat is good, right? We complain when it's too hot, we complain when it's too or it's not hot enough. So what can we do?
Yeah, and I definitely prefer heat to the cold any day. So no complaints here.
Absolutely. Same. So I am literally so stoked. This is our first live stream that we've done on this channel. So I know, isn't it just wonderful? But it's there's good and bad because unfortunately Kat couldn't make it. So
Yes.
we are down one hostess. But we will make it the best that we can because we've got a fantastic subject to talk about, which is Andy Burnham and his views on social care.
Yes. 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 So this is, I feel like before he even decided to, before the announcement, everyone was talking about him and his opinion. So I don't think it was a surprise to a lot of people when we all knew that he was going to be in a running to be prime minister to to step into the shoes of Keir Starmer. So I'm excited to get into it and to get the views and opinions of anyone who's joined us on what they think about his views, his thoughts. And some people think it's controversial. I don't know. So I'm excited to see what people think, or hear what people think, rather.
Yeah, absolutely, and that brings a a bit of urgency really to it, just to say to people. You can actually put comments in the chat. We want this to be really dynamic. This is us. This is what we're talking about. We're going to be discussing live his views around social care, and the way that we managed to get those views is, of course, the interview that Co-Produce Care had with him during the pandemic. So that's where we Co-Produce Care, obviously the organisation that I run, we do a lot of live streams, and one of the many MPs we've had on there, including ministers, was Andy Burnham, and he was comfortably in his lounge talking about social care. And I've not seen any other live stream or interview where he is spent the whole session talking about social care.
You
So
did an exclusive, Sophie.
I did an absolute exclusive. So the full video, I think we could probably get the link and put it in the chat there for people to look at another time. But this time we want to kind of really dissect some of the things that he said and see what we think about it as a care sector now, because there's not huge amounts that's coming out from him at this point in time around social care, staying a little bit strum, a bit more about the NHS, but he has some views on it that he shares with me in the interview, and I think it would be a good opportunity to just go into a couple of those that we want to explore, and we'd love to hear other people's views on them as well. So feel free to comment as he's talking and as we are watching the videos back. But before we go into that, just a bit of an update on obviously The Three. That's our new podcast with Kat, and I think we're on episode 4 or 5 now. We've had some great guests. Yes.
And this is our first live on The Three, but this is our second live together.
Yes. So people can look back on the other videos, which are fantastic. We've interviewed people from the NIHR. We've interviewed a care provider who's been struggling with his business and what he's had to go through with local authorities, and just the terrible practices that go on in the sector, and the way that providers are treated as a afterthought sometimes, even though local authorities they do have responsibility to make sure that the market in social care is functioning. So please do go back and watch that. But a bit of an update, I think, is always good on what we're doing in our respective worlds. So I know you've been working hard with providers and with your app and with helping people with tendering. So what is your world looking at over the last couple of weeks, Sophie?
Busy. Yes. So I have been on the field. I'm always on the field. And that's where I prefer to stay, working closely with providers. And as a bid writer primarily, we're always trying to get providers into frameworks. So, yeah, and that means obviously understanding the operations, and as well as the bid writing aspect of it. We also help with the contract implementation as well. And now we're in the tech space as well. So really, really busy working with the providers that we have gotten on frameworks to test our technology, because we don't want to just bring another digitized chaos into the market. We actually want to bring a solution that works. And so, yeah, most of the days I'm actually every day speaking to providers. So when we're not trying to get them onto a framework, we're trying to get them to test the product to ensure that it's fit for the market.
That's great. What are you seeing in terms of frameworks at the moment? I feel like it's a really unknown space right now. It used to be a sure thing that you get onto a framework,
Yeah.
and now it seems quite, I want to say, flooded with providers. It might be that I've just seen a couple of them that are quite tricky, but frameworks are difficult to get onto. But what are you finding? Are you finding that it's more difficult to get onto frameworks at the moment?
Absolutely. Let me give you an example. So the ICB Surrey framework just opened either today or yesterday, and it's open for 11 days, Sophie. 11 days.
What?
First of all, yeah, I know, so crazy. And then typically, even if you don't have a local office in the area, as long as you put in a good bid, it could be considered. Now, to even the eligibility criteria is strict. They ask you for your CQC location ID, and that's the eligibility. So yes or no. So if you, and that's that. And then, so if you're not based in Surrey, as an example, then you're not even gonna, you wouldn't even get access to documents to even have a look at it. And then there's the Hammersmith and Fulham, which is a completely different ball game, where the requirements is just through the roof. It's, in my opinion, I think they've designed it in a way to exclude small providers, even though the market positioning statement says they want to be inclusive of small providers, but the requirements makes it impossible for small providers to even get a leg in, So that's what I'm currently seeing at the moment. It is, just to answer your question, is getting very, very difficult to secure framework bids. They feel you on the silliest thing. And you're just thinking, this is a provider who is in your borough, who they ask you for the relevant contract experience, and it's someone who already works within your team and within your borough rather. And then, you're still asking them to jump through so many hoops. So to answer your question, yes, I do think that right now is quite tricky. And you have to be even more thorough. Bidding is a thorough exercise, but now there's literally minimal margin for error. So that's what we're currently seeing at the moment.
That's why services are like yours are so important, because I used to think it was a fail-safe, like you would always get onto a framework, but now I get quite nervous putting in framework bids, because I'm like, I know the commissioners and I work with the local authority, but I don't know if they're going to get me on with the framework again. I get quite nervous because it's that tenuous. It's really tricky at the moment. But I think that they've got to manage the influx of providers that are signing up for this, so for frameworks. So that's their way of doing it. I totally can see their point of view.
Yeah. What about you, Sophie? Enough about me.
So yeah, I have been doing too many things to even think of. I've got this crazy spider diagram on my wall, and it's got all the things that we're doing at co-produced care. And I look at it sometimes thinking, oh my God, what am I going to focus on this moment? But one of the big things that's coming up is we are doing a care sector call, which I'm starting I'm starting on Wednesday. It's our first proper one. And the whole idea of the care sector call is that I want to bring as many people from the care sector together onto one call. And the inspiration I've got from that is during the pandemic, I organised there to be a weekly call with all the providers in our area, because I had such anxiety that, when it first happened, the local authorities had nothing that they could share with us.
Yeah.
We just felt
people listen, when you say call, the first thing that they might think about is NIHR, like, oh, there's a call. So research call. What are you actually referring to when you say call?
So it's literally, so this is it. So during the pandemic, I invited loads of everybody, all providers, to come on like a Teams call. I think it was Zoom at the time, and I had MPs, I had the public health, local authorities, our care association lead would come on the call, give updates of PPE, safe ways to work, what's happening in the local sector, what to watch out for. And sometimes we'd have like 150 people on the call every week, and people were just hungry to find out what the juice are you doing in this pandemic where there's no help from the government and we're being told there's a protective ring and we can't even get frigging PPE. So that's when I found that really beneficial. And also I got so much good feedback from providers saying, oh, well, your call was great. It really helped me during that hard time when we didn't know what was going on before the help started coming in. And I thought,
so for the providers listening right now, how can they get involved?
yeah, so we're going to, we might actually get a link in the chat so people know how to join. But the main way to do it is just sign up to Co-Produce Care's newsletter, and then we send out all the links there. And we're going to do it every month. So like you can encourage providers to pop on. It's totally free. And this Wednesday, we've got a climate strategy expert from Oxford University. She'll be talking about how to be safe in the heat wave. She spoke to me about how actually more people die in social care, in care homes, than they do in the NHS during a heat wave. And actually, what we should be doing is care associations can join with researchers like herself to put a case to local government, to maybe the ICSs, that care homes need extra ring fence funding for heat planning, so hot weather planning. So that was really interesting. We have got Olenka Thomas, who you'll know probably. She's got her own consultancy. She'll be talking as well. And we've got some Nadra Ahmed from the Care Association. She'll be talking about what they're doing at the NCA. So yes, a lot going on.
Very exciting. Very exciting.
Yeah, thank you. So I think we are just so lucky to have a guest to come and join in this conversation about what Andy Burnham said during the pandemic about social care and dissect that. So I'm just going to join Jazz Meet into the live stream. Hello, Jazz. How are you?
Hi, I'm good, thank you. How are you both? It's so nice to see you again.
So hey, good to see you. I'm well, thank you. How are you?
I am good, thank you. Have been keeping well, even though we've had a lot of heat waves, but it's actually the heat waves are obviously not a good thing, but I'm glad that people are talking about the need to do stuff around the climate crisis and heat waves and support people who are either living in, receiving care, working in social care. They are some of the most affected communities. So I'm glad it's on everyone's radar.
Absolutely. And actually, that's one of your things, isn't it? You're interested in. Sorry, Obi.
No, I was going to say, I love that every moment for you is an opportunity to educate us on either climate or policy or politics.
Or women's health.
Like, oh, it's a hot day today. Oh, yeah, it's a hot day today, but this is what you need to be doing as a provider.
Absolutely. I mean, okay, I have a lot of opinions about a lot of things, but I think that the reason it's so easy to talk about so many of them is because they're so interconnected. You can't really talk about social care without talking about, like political policy, healthcare, transport, infrastructure, workforce, climate crisis. Like it's all interconnected. So I'm happy to find any way to connect things back to that as well.
Yeah, I find like not a lot of people talk about it. A lot of people have your experience because you're quite niche, aren't you? Because you have field experience as well, and now you've gone into a different sector, so you can actually sort of like triangulate all of that. So who better to talk about it than yourself? So yeah, we welcome it very much.
Thank you. I mean, I don't know, do you want me to do a quick introduction or?
Absolutely, please go ahead.
Okay. So yes, hi everyone, lovely to see you again. I'm Jasmine Wright. I was former associate director at RCH Care Home, so that's what Obi mentioned in terms of I have the fieldwork operational experience. But to clarify, it was not frontline care, it was like strategy, innovation, all of like the behind the scenes stuff that a lot of people don't see. And now I've taken a step back from there and I've pivoted into the intersection between women's health, climate crisis and social care, and especially their impact on marginalized communities. So yeah, the climate crisis and women's health are two big passions of mine, and they're heavily interconnected. So currently I'm building I'm a co-founder. We're building towards a climate startup to support people who care about the ocean, want to help protect it, but have no idea where to start, called Ocean Action. So that will be launching later this year, and a climate consultancy to support social care providers on their journey to net zero. So that will also be launching later this year. But if anyone has any questions, feel free to reach out.
Wonderful. And what we'll do is we'll try and get your LinkedIn or something and put it in the chat as well so people can connect. Fabulous. So what do you think, Obi? Should we start showing some Andy Burnham videos and see what people think?
Absolutely.
And I've seen some comments in the chat. Please do, as he's talking, just say what you think in the chat. It'd be really good to help the discussion. So I'm just going to change the layout. And should we, since we were talking about housing, should we start with housing? Yeah, yes. Let's do that. Okay, listen up, guys.
Absolutely. And that is another issue. People don't consider housing as part of the whole debate with social care.
Yeah. Do you mind if I say some? Sorry, Sophie. I feel
no, carry on.
Could overrun a little past if you wanted to, but that is honestly such a fundamentally important point. When Aneurin Bevan created the NHS, he was the Minister of State for Housing and Health, and I think that post-war government understood the kind of inseparable link that there is between those two things. Without good housing, you simply cannot have good health. It's impossible. You will never have it. And in Finland, I've done a lot of work on homelessness. They have a national policy called Housing First, which basically says, there's no point paying for expensive healthcare if we're not looking after people with good housing. So sort their housing first, and then everything else will follow from that. And I think it's such a good philosophy. And I think we need to sort of to apply something similar. It's so fundamental, housing, for people living a good, healthy life, that I think, we should have a right to decent, safe housing enshrined in UK law, in the same way that we guarantee people rights to universal healthcare and universal education. You just cannot have a good, healthy life without good housing. And yet we've allowed the market, I was going to say the market to sort of to fix this, but it hasn't done, has it? Because it's left a lot of people with expensive housing that's often not particularly safe either, because the private rented sector has such variable standards. So housing, you're absolutely right. Building health starts in people's homes, definitely. And if you live in a private rented home where you live in fear of eviction because you're on a 0 hours contract and the landlord can do a no-fault eviction, people's mental health goes completely downhill in that kind of scenario. So secure housing, absolutely. There's no health without it.
So secure housing, there's no health without it. And I want to, if you will bear with me, I actually found the article about this Helsinki place. So I will just share my screen, bear with me, to show it does exist. So this is in Finland. It's the only EU country where homelessness is falling. And what's secret is giving people homes as soon as they need them unconditionally. So that's an article around that project he was talking about, which people can go and have a look at and read themselves. And incidentally, I also, which may come up, so I won't spend too much time on it, did an article for HSJ magazine around about mental health trusts spending millions keeping people who are ready to leave hospital, but they can't because of the lack of supported housing. So it's a big thing. It's a big thing. So I don't know what you guys think about that, what your views are and what he said. I feel I want to come to Jazz first, Obi. What do you think?
Yeah, go ahead.
Okay.
So I think my short answer is that I agree with him that housing is absolutely essential and you can't have good healthcare without good housing. But the more nuanced answer is, so actually, I'm aware of that Finland's pilot study that they did. And from, I can't remember all of the details, but one of the things within it was that they provided housing for either 6 months or 12 months from the outset. And because people had the security of, and the lack of mental stress, or sorry, the stress of knowing that they're not going to be evicted for that period of time, their mental health absolutely improved. They were then able to improve their physical health, and they were then able to secure jobs and then, you know, move into their own housing elsewhere. So that housing first initiative is one that I'm aware of, and I, like, from what I've heard of it, I'm a big proponent of. I mean, when it comes to housing, there's so much that's interconnected, right? So if you're living somewhere where there is a lot of mold or there's a lot of damp, that is absolutely going to impact your physical health in terms of respiratory conditions, like potential asthma, long-term conditions, and then you live with those ongoing cumulative effects of health, and then eventually it ends up either you need to access care from the NHS on an acute basis, or you need to access care on a chronic basis, often via social care. And a lot of the people who work in social care, they are also living in housing which is in the nicest possible way, not always up to scratch. I think it's not the most tactful way I can put it. And so again, you're expecting a workforce to care for people when their own health is being damaged as a result of multiple different policies. So yeah, I fully agree that housing first is definitely a priority. I think the impact on mental health is significant, but also housing first can be the green infrastructure that you have nearby. So there have been various studies done which have found that there are higher numbers of excess deaths where in neighborhoods which have removed trees, and once you add more trees into a local neighborhood, the number of excess deaths actually decreases by like thousands. And then also it has an impact on like lower inflammation, lower cardiovascular incidents, lower stroke, lower diabetes, lower respiratory conditions, improves mental health. So the two are interconnected.
Absolutely. What was your take on it, Obi?
So for me, I'm going to speak on it from the perspective of access, supported living, particularly. That's the space that I'm primarily working in at the moment. So my thing is, when you hear MPs say housing first, yes, absolutely. We know that, you know, if you live in a really good housing, if your housing conditions are great, then your health, your life expectancy increases. We know all those stats. But for individuals who actually, like one of the in the article that you pulled up, where it stated that there are individuals right now in the hospital who are still in the hospital who can't live in the community. So as I speak to you today, there are supported living providers who can actually provide amazing houses to those individuals. And when we started this conversation, we spoke about the frameworks, how the frameworks are getting even more difficult to get onto. So if there are people in hospitals today, and we say housing first, and there are developers who are willing to put the money in, there are investors who are, I know commissioners don't really like to, you know, they're not happy with investors coming into the care space, but there are investors that can build beautiful homes for individuals who need support. There are social housing landlords that can work in partnerships with people who build homes. And why is it taking so long for local authorities to commission individuals who can actually provide these services? So for me, working collaboratively together. So when they say housing first, I don't know, what is the infrastructure in place? What is the infrastructure in place to actually make that happen? It's not there. It's not there because as I see today, there are providers, there are investors willing to invest in the space, there are providers who can deliver fantastic services, but it's just not happening. So how do we deal with that? That's my question.
I've got another question on top of that question before we think about how we deal with it, just to unpick what you said. Why do you think this is happening? Why do you think there are providers and there's actually a willing and able market, but local authorities aren't accepting that market? The only thing I can think, and I entirely agree with you, Obi, on this point, is that local authorities don't have enough money. So because they don't have enough money, they are gatekeeping the availability of these services by not providing enough, because they don't want to have to then have providers who are like, well, we need our beds filled, and to then have to pay for it from when they're already really struggling with the bottom line. So if the services don't exist, they can say to people, well, they don't exist, rather than having to put people in places and have to pay for them, and social care becomes even more expensive. I may be being a bit cynical on this point, but I do wonder whether there's something behind that. But if you're saying, you know, people are, the statistics don't lie, people are in mental health hospitals, they can't find anywhere to go. There are providers out there who say they can actually support them, but somehow the two aren't meeting. So I don't know.
Yeah, so I think that's the question. So who needs to work together? So for me, what I would love to see is more collaborative working. So more talks surrounding collaborative working, and these questions being answered, because you don't know the answer. We're all speculating. So, but that, if anyone could actually solve that problem, there will be more people living in better homes in the communities. And I know, like when I listened to the video, he covered quite a few areas of social care. You've got the homeless aspect of social care, care leavers, supported living, and even people who don't draw on social care support as well. So, but I'm speaking about individuals who actually draw on social care. So yes, housing first, I support that, I agree with it. But if truly we are saying housing first, then we should put together infrastructures for other people to come and actually support this mandate. So for me, that would mean possibly working with investors, possibly. I know commissioners don't particularly like that, but it's maybe something that we should maybe start thinking about doing more of.
Yeah, I think an element of it is also that there's so much disjointedness. Like I have definitely, so for background, I've worked on the care home side, so I don't know supported living as well, but on the care home side of things, there are discharge teams in hospitals. There is a capacity tracker that social care providers have to complete. But you then have, for example, the care home will call up the hospital and say, we've got capacity, like who do you need that we can transfer into the care home, like we can support you through that. And a lot of the teams, they're not talking to each other. So it's like the discharge team knows some information, another team knows something else. Their systems aren't fully talking to each other. They're definitely not talking with social care systems. I don't know who currently has the answer. I think it's a very big question that you've asked. And I think anyone who does have the answer will definitely, like, they need to speak up more.
Yeah.
But I do think, I think some of it is a lack of funding. I fully agree with that. But I think some of it is also an element of disconnectedness. And I think part of that disconnected is also people just don't know what social care does. Like if you say I need to go to hospital, people are like, I know what you need, right? Or like, I know why you're there. But if you say I need social care or I am receiving care from the social care sector, they're like, I don't know what that means. And so I think there's an element of that. And this is anecdotal, not evidential, but on an anecdotal basis. I remember when the ICBs were introduced, and from then till now, I know very few care providers who've actually had direct interaction with ICBs, even though those ICBs are meant to be the voice of social care, or like have social care at the table. So some of it, I think, needs to be at the table.
Yeah, absolutely. I know a lot of care associations who get very irritated that ICBs don't have enough social care representation at the table. I think it's 100% intentional, because it's very easy to do that. Or what they will do is they'll have one or two very big providers who are out there on the board, and that will represent all of them, and it's just isn't helpful at all, because you've got that power imbalance. If you've got all of these health professionals, then you've got one or two providers. It's really difficult to be in a room like that and then be the one person that disagrees with everything. They're going to have a vested interest to keep everyone sweet as well, because they want them to, they don't want to be blacklisted. So I definitely think there's some serious politics going on locally in that sense, which is really sad, because the person that doesn't benefit is the people who are drawing from social care. So
can I add one thing as well, because I do agree with what you're saying, but I also think an element of this is thinking that it needs to be an either or choice. Like people think that you have to have either housing or you need to focus on reducing fuel bills, food bills, etc. It's not necessarily an either or thing. Like a lot of these things, they, like I said, they're interconnected and they compound on each other. So for example, there are communities out there who have focused on building their focus was building affordable housing. One of the ways that they focused on that was making sure that they are adapted to different weather elements. So whether it's protecting from the heat, protecting from the risk of flooding, etc. But because they focused on that affordability from the outset, they then also ended up having a compound impact where it ended up being better for the environment as well. And they were able to, in some cases, like repurpose solar energy so that they're producing so much, they're actually making money off things. So it's, one policy that there needs to be more consideration of is retrofitting old buildings. I think there's an aspect of people saying like we always need to build new buildings which have got like AC and have got all of these other features, but it's often a lot more affordable and it's a lot less environmentally damaging to retrofit existing buildings. And bear in mind, like most of and again from a care home perspective, I know more about the care home side of things. The vast majority of care homes are old converted buildings. They are decades old. They are designed to trap the heat and also be susceptible to flooding, which is, I think, an element that we don't talk about.
100%.
Yeah, absolutely.
Should we hear more from Andy?
Sure. I was thinking maybe we could look at the comments. I don't know if anyone has anything to say.
Yes, we've got quite a bit in the comments. So how far do I go back? Nat has been really, really great with a few things there. I think I popped up something here. Everyone in the UK who is an assessed need has a statutory right under UK law to be housed in a supported environment, which is good for their needs. Fulfillment is a right, not a privilege. 100%. Yeah, absolutely. But I think for me, the gatekeeper is the assessment.
Yeah,
because once the assessment's been done, that's the statutory obligation done, but then the actual placing of the individual, then that's where the problem starts, isn't it?
No, it's assessment. So the parameters of being assessed as meeting the threshold, if they're set as quite high, if you don't pass that assessment threshold, then that's where you can't get access to all of the good stuff that you need. So sometimes the assessment itself can be quite it's like people saying the assessment for universal credits, they're really like someone will have obvious needs, physical needs, and still they'll be assessed as they can go out to work and they can do things, so they don't get the enough money that they need to kind of live their lives with dignity. So for me, sometimes the assessment can be the tricky point with that, but it's a really good point. Were you going to come in on that as well, Jazz?
I was going to say the same thing or a similar thing, as in I think assessment is one of the bottlenecks because there's such a long waiting list to get assessed. So you're right, once you're assessed, there is a statutory right that has to be fulfilled. But before you're assessed, you're just in this limbo. And I was going to make the same analogy about disability benefits. I think we hear a lot in the news about how such and such benefit needs to be reduced, needs to be scrapped, etc. But what it ends up meaning is that those people for people who are living with disabilities, they already have a higher cost of living anyway because of the infrastructure and support that they need. And I'm not even talking about like support from a social care perspective. I'm just talking about like the mobility aids or whichever other infrastructure that they might have, higher food costs, etc. And then when people are talking about disability benefits being scrapped, it's often by tightening the assessment criteria and saying you've got to meet an ever increasing level of XYZ criteria to be able to receive, like you said, this basic funding, which is often like a pittance, so you can try and attempt to live a life with dignity.
I agree. I'll just do one more comment and then we'll go, which is we'll go on to the next clip. And then, which is a nice, cute one. So someone said that they know Andy and the former Labour councillor and can honestly say he's a good guy. He takes social care very seriously and I believe he's committed to delivering real reform. Oh, lovely.
Wait and see.
Yeah, that is promising to hear, but we will wait and see.
We will wait and see. And, people often say to me, just like temper your excitement about Andy, because, when he came onto the live stream, he was, I was I'm not going to show this bit of the clip because it's a bit embarrassing, but I was gushing a little bit saying, oh, it's so good to hear an MP who understands social care and just knows it and just gets what we're talking about. And but it really was, because I've had a lot of MPs on my podcast and I've spoken to a lot of them, and some of them are literally reading from a script, and there's no heart, there's no connection with the community, and there's no understanding of some of the arguments. But he was just reading stuff off without me having prepped him that much. We did have a little bit of prep, so he did know some of the questions beforehand, but he didn't have a script. He knew he actually spoken to people, and it felt like he's very much a people's person. But then what people say to me when I say that, they say, yeah, but Sophie, he's now in the system. And Andy Burnham as mayor has got a very different type of, you know, power than Andy Burnham as prime minister. So don't get too excited, people, but let's be excited for a little bit.
I don't think there's anything wrong with being excited. I think that one of the ways that people discourage engagement with the political system in whichever form, whether that's local or national, is by being really cynical and saying like everyone's the same and all politicians are the same and like no one's ever going to make real change happen. But we do have real change that happens. Like, just a policy off the top of my head, one of the reasons that we have maternity leave as a policy and as a statutory right is because Harriet Harman was one of the people who was fighting for it. She came into Parliament as an MP, and obviously she's done other things, but she fought hard for the right for maternity leave to exist. And now we take it kind of not for granted, but as in like, of course we have it. Like, why wouldn't we have this as a statutory right? So I think people can make real change. And I'm not going to lie, I'm also excited about Andy Burnham coming in, or hopefully coming in. I think, regardless of what happens, and I am hopeful that he does make change, at the moment, we as a country have been having a lot of negativity when it comes to politics, and it's nice to have some hope and some optimism, and where people are talking about what can we change to make things better, not just how can we kind of like scratch away at the edges to keep the status quo as is.
So what are you excited about the most? What do you think Andy's going to bring? Because you're a voice when it comes to speaking on politics and the social care space, so we want to know, what are you most excited about? What should we be? What should we be looking out for?
I mean, there's the things I want him to do, whether he'll do them or not, who knows? One of the biggest things I think we need to have is proportional representation brought in to as a voting system. So one of the reasons that we are so disengaged as a country, as in terms of politics, is that you think that you vote every 4 or 5 years and that's it. Like, you don't need to do anything else. That's like the bare minimum. But one of the reasons people don't want to vote is because they feel that vote isn't counted. If we have proportional representation, we will have every vote being counted equally. So whether it doesn't matter whether you live in a so-called like safe Labour seat, safe Tory seat, like whatever it is, you will have more of a say. And because you will have more of a say, I think people will then feel more engaged with the process and feel like what they say and do actually matters and it has an impact. The second thing that I think needs to happen is we need to, and this is a long-term one rather than a short-term one, we need to rejoin the EU. Like, every study and economist that comes out with any of the numbers basically says that us leaving the EU has completely destroyed the country's finances, the economy. Whether you look at it, I honestly don't know, and I think some of it is going to be things that happen behind the scenes without it being outright said, oh, we are officially rejoining the EU. Like, in the 2 years that Keir Starmer has been in charge, we have become closer to Europe in terms of aligning on policies. There's been a lot of work that's been done, for example, revitalizing, what is it called, the youth scheme, like Erasmus, where there is more movement between, or there's more support for young people to go and live in other countries. And like, from a social care perspective, some of those people who work in other countries in the EU, they would come and work in social care because they were able to move here more easily and freely. So yeah, if you want to say that you're going to improve the economy, the real levers that you have are to have closer alignment with the EU. And also from a regulatory perspective, from a defense perspective, from a geopolitical perspective, from a health perspective, like, we are in quite a lot of alignment. There's been a lot of work that's been done by various organizations behind the scenes to basically repair a lot of relationships which were, what's the term I start for? Which were burnt quite badly in the years from, let's say, 2016 to, when did he come into power? 2024. And so I think, yeah, long term, having some mechanism where we as a country choose to rejoin the EU, but if not that, then some kind of closer alignment. Sorry, one of the other reasons that it has impacts and like having alignment with the EU is because it impacts things like medicine. So the medicine supply chains, medicine shortages, even things like the US trade deal that was done with Donald Trump and his administration, where we have agreed that we're going to pay more for medicines that are coming out of like big pharma out of the US. That's going to cost something like £45 billion to the UK. And there was an article that came out the other day that is going to be responsible for like likely many unnecessary deaths, but just because people are not able to access the medicine that they need because the prices are higher, because the NHS is obviously paying more for these medicines. So this is a very long, convoluted way of saying that it's easy to say that politics is not something that people should care about, but it does actually impact everyone's day-to-day lives, like the accessibility to their medicine, for example.
So for the listeners, Jasmeet's very passionate about politics. So if that hasn't come across yet, then you haven't been paying attention. Just thought I'd add that.
Amazing.
Right, thank you.
Yeah, so I'm going to play the other clip. I'd love to hear what people think about Jasmeet's comments about the EU, about what she would like Andy Burnham to focus on when he comes in, and also what you listening would like him to focus on. If you're listening live or if you're listening on a replay, just pop it in the comments because we'll read them all. Okay, so parity of esteem with healthcare. Let's have a look at this next clip from Andy.
We did have a question from Martin Routledge. He wrote in, how do we give a proper hearing to disabled people and others who fear the idea of the NHS running social care? I don't know whether it's useful to really unpick what you mean about this sort of integration. Is it a national care service like we have a national health service?
Yeah, so I understand that question very much so. I think the way you deal with it is by giving people rights within that system, rights to the way their care is provided, more control over their own care, and not just sort of, sort of paper rights or sort of flimsy sort of commitments, actually proper rights over how people can ensure that they get what they need. So for instance, it could be the right to care in the home, the right to a single point of contact for the coordination of all care. And when people talk about, I don't see this as an NHS takeover at all. Actually, the way I see the future would be local government in the lead with a single budget for health and care commissioning from an integrated NHS system, but often might be the NHS working in partnership with voluntary and community organisations. Who would have the job of providing that informal, everyday support for people within their homes. So I'm absolutely clear you can get this right. Where I think it doesn't work is if you think of this as two systems, because what we end up with is underfunded social care where people are left struggling at home, and then them drifting towards the most expensive bit of the system, which is the acute hospital, where all the money gets sort of trapped there. I think if you go towards a more integrated approach, you would end up, I hope, spending much more upfront on preventative care within the home, personalised care, because I think that's the way the NHS becomes sustainable in the long term.
Okay, that's really helpful.
Okay, so a lot to unpick there, but yeah, National Care Service. What are we thinking? Do we think that would be a good idea? Is social care going to be subsumed into the NHS type function? I personally think we might lose quite a lot of the way that social care runs, but
you say we might lose some of the way social care runs. What do you mean?
Well, I feel like we're very much community based. We aren't so hepped up with systems, and we are able to provide quite individualized care quite quickly and respond to people's needs. And once you start making things a bit more centralized, if it's literally just the payments and just funding it from a central system, that's fine. But the worry, I think that's why I asked the question, the worry is that if we're going to try and mimic what we have in terms of systems and processes and culture that the NHS has, we will find social care becoming quite inaccessible and quite a different beast to what it is at the moment, and essentially more expensive. So I was just a bit worried about that. But I don't know what you guys think about his comments on the National Care Service and commissioning from an integrated system. I think this was before ICSs were probably embedded. But yeah, I don't know what you guys think.
Maybe do you want to go first? Because I feel like I'm monologued for a while before.
I mean, is it working at the minute? Like you said, we do have ICS, we have the ICB. How is that working out for us at the minute? Are we actually integrated? How is the ICB doing at the moment? So perhaps maybe we could start there. So that's what I say. So I like what you said, Sophie. I agree with it. Social care by design, it's a bit more community based. So if we do merge it, then I guess it's a case of how do you ensure that the two separate models, for want of a better word, stay separate, as opposed to joining it and then us losing what's great about social care. So for me, we've started that transition. Integrated care services is a word that I guess is in the zeitgeist. Everyone talks about it. It's operationally in policies. So what is it? We have the evidence right now. Is it working? Is it working for you, Sophie? You're a provider. Do you work with the ICB? Do you work with the ICS? How often do you integrate with the NHS? So you could even speak from a lived experience. How is it working for you, Sophie?
I don't think it could work a lot better. I think where the local authorities are at the moment, they are just really, really struggling. So the idea of having everything a bit more centralized is quite appealing, but it's just how it will be executed. And I think it might become quite political. But then you might have a situation where you do eliminate a bit the postcode lotteries around care and standard of care and quality of care, and because of how it's funded, you won't have to be reliant so much on locally how there'll be a standard basically, so that it might, for the actual end user, it could be better. But I think it's just the way that it's actually implemented. Would it mean like a standardized national framework for the workforce? Obviously we've got the fair pay agreement, but are we then going to match the pay for NHS social care staff with NHS staff? I mean, that would be amazing, because they really do hold up the system, but they just don't get what the same terms and conditions that they do in the NHS. So, but then it would all have to be funded. I think it's one of those things that when people get down to the nitty-gritty of it and the cost of it, unless it's a more NHS will give over some of their funding to social care, so there's not needing to be huge amounts more, which is never going to happen. It's going to be through taxation. We'd have to, as a nation, where they'd have to go out for another referendum, I don't know, but as a nation, I think we'd have to come together and say, quite rightly, we're happy to pay more, and we're happy to be centralized like the NHS is. And I mean, that could be historic, but whether we have a politics to actually carry that through, I don't know, because that's a Bevan type change. Yeah, I don't know what you think about that, what he said, Jasmine.
I think, I mean, well, does anyone have the political will for that? Like you said, that is a huge amount of political will that you need, and you have to be willing to burn a lot of political capital in order to make that happen. And I don't know who is willing to do that at this point in time. In terms of the National Care Service, I agree that it is going to really depend on what that looks like. If it is the NHS taking over, then I'm not entirely a fan, because I think one of the, I mean, I'm echoing what you both say, one of the benefits of social care is just how agile it is, how individualized it is, and how innovative it is. And I think you lose that when you go from something which is very small and agile to something which is like very institutional, hierarchical, where it's very difficult to implement any changes, whether that is we want to introduce a new policy, we want to change the infrastructure in this particular community. I think that is something that there's a risk to losing all of that. I also think that having a conversation about a national care service without having a conversation about all of the things that connect with it is quite naive. So at the moment, 80% of the social care workforce and the healthcare workforce are women. There's a women's health strategy paper that came out, like a month ago, 2 months ago? But within, and they've got all of these targets and goals of like women need to be able to receive this care and they need to be able to receive that care. And it's like, okay, but who is providing the care for the people currently providing the care? Like, if you have a workforce which is made up of majority women and you don't have like menopause support in there, you don't have, I mean, there's so many aspects from like cardiovascular, musculoskeletal. If you're not addressing that, then you're not addressing how you're actually going to provide the care. So it's easy to say, let's have a national care service, but how are you actually going to do that in terms of like the workforce is a question, but also in terms of things like just infrastructure. So we have an aging demographic. One of the things that we are probably going to need to do, if we're not already doing so, is look at transport infrastructure and like the pavements, roads, etc. If you need to have wider walkways and where people who need wheelchairs or mobility aids are able to access them, who's funding that? Like how? And if they are not able to do that, then you're going to end up with people in quite isolated homes or communities. And then we all know that isolation and loneliness is a risk factor to increasing, for example, dementia and mental health issues. And I don't know, I think it's just such a big topic, and I think it's easy to say, yes, let's nationalize the care service, but how that actually looks. I also think that people think it'd be as simple as, for example, nationalizing rail or nationalizing energy. Over in those industries, you have a couple of organizations who essentially have a monopoly on the whole thing.
Yeah. What I'm hearing you say is
tiny SMEs. Like, how are you going to do that? And honestly, I think there's so many great things about social care. If it's very much the NHS
as social care, so the commissioning, we can nationalize the commission, we can nationalize that, but the actual operations of it, the delivery, should be kept separate. That's what I'm hearing.
Yes, but I also think there needs to be learning from social care to the NHS, as in like the NHS is learning from social care. So one of the things that I used to do when I was at RCH is I was one of the people who like read through the team surveys, the resident surveys and the relative surveys to like basically amalgamate the results and see the trends, etc. One of the things that often came up, which is quite interesting, often from relatives, is that they are a lot of people who are working in the NHS and they don't realize the extent of what social care does until they actually are they have a loved one who is receiving care, and they will come in and they'll go, for example, like, I'm a nurse in the hospital and I'm seeing people, so I'm seeing care assistants, senior care assistants doing a lot more. They're incredibly more upskilled than the care assistants in the NHS. And then you also have the factor of like the parity of pay where it's not remotely equal at the moment. I remember, I mean, these results, these stats are kind of like, what, 4 or 5 years old when we did the white paper for the people plan for social care. And at the time there was a report which basically said that a care assistant in the NHS is earning, I think, £7,500 to £11,500 more on average per year versus a care assistant doing the exact same job in social care. And so you've got to increase funding so that you can pay your workforce better, but then you also need to not make it so that it's the NHS telling social care this is what to do. Social care needs to be able to say to the NHS, learn from us, innovate with us, because the social care sector is incredibly innovative. I mean, they kind of have to be. Necessity is the mother of invention and all.
That's how I feel.
Oh, please.
No, I was going to say that's how I feel. Like the whole social care sector is incredibly innovative because it has to be. I mean, if there's any test of evidence to show that it is that way, is the pandemic, and it pulled through in a way that I didn't even think was possible. I mean, there were real huge tragedies across the health and social care, but social care was really left out in the cold. So it is resourceful. It is time that it gets better funding and support, because I just think thinking with the National Care Service, obviously Scottish Government have gone towards that, and I'm just looking at their process. So there was an independent review, and then there was a consultation and co-design process. And then obviously you did need quite a lot of political will, I think, because there was a little bit of backlash politically to put it forward and to go through with it. So we have got blueprints to look at and to learn from. And so there's something that we can actually look at. And you know, there's still quite a few remaining key priorities, like parity of steam with the terms and conditions. I think that's always going to be a bit of a sticking point, but they have started the process, so it can be done. It can be done, and if there's political will, then you can go towards it, I suppose. Yeah.
I mean, even the NHS as an example, when that was first implemented, a lot of people weren't in favor of it. Like the government that brought it in essentially lost, well, amongst other reasons, but one of the reasons that they didn't win the next election is because the idea of the NHS was so unpopular, and now it's a beloved institution, and the idea of people attacking it and privatizing it is awful. And like we now take it for granted that you have a universal right to healthcare, but like back then it wasn't popular. So if someone wants to do something which is going to be for the betterment of the entire country on a long-term basis, then there are examples of history where it's been done, and they can take that as inspiration. Like they're not necessarily needing to reinvent the wheel. Oh, sorry.
Oh no, I was going to say, I wonder what the comments say. Are there any reactions to it?
Yeah, there's a couple just, you know, talking about how Scotland doing things a bit better, which is 100% true in that sense. And then just people just generally enjoying the conversation, which is great. It's good to hear feedback, mainly good, obviously, but do keep the discussions going in the chat, please, people. I really appreciate that. We all do. So we've only got a couple of minutes left. Do you think I'll play maybe half of the last clip, see what people think about that?
Okay,
fine, let's do this.
I think you need to redefine levelling up. You know, levelling up has been kind of thrown out there as this idea of building big train lines to parts of the north and the West Country or wherever, and that is not going to level up the poorest communities, in my view. If you are serious about levelling up, you would actually go to the places where the housing is poorest, where the work is the least secure. You would start, I would say, a massive improvement program in those areas. You would improve people's homes and their communities. You would legislate to get rid of 0 hours contracts. You would guarantee people a real living wage. You would, I think, start by levelling up the social care workforce to the NHS workforce, and you would pay people on a equal pay scale. That would be levelling up, a much more meaningful levelling up to me than the one that's currently spoken about in the media. You know, levelling up starts in people's homes. It starts in people's communities. That is where health is built. And as we've seen, lots of our fellow citizens are living in communities and doing jobs that doesn't allow them to protect their health. And, I hope, I live in hope that the country will demand those things coming out of this. I hope so.
So, last thing, it's very much similar to what we've been echoing already around that parity of esteem, but just a kind of a shopping list of what levelling up, how it should be redefined in the context of health and social discussion. So, I don't know if you wanted to pick out anything in particular. I know he talked about going to the poorest and actually say that's where we need to start when we're thinking of levelling up. Those are the communities that we need to focus on, and then start from there, which makes sense. A real living wage, so not just a living wage, but a real one. Living up the workforce, health and social care, which we talked about, and starting with focusing on homes and communities. So I don't know if Obi, did you want to pick out anything from that, I suppose, that kind of stuck out? Oh, we've lost Obi.
Okay.
We might get her back. Let's Jazz, let's start with you.
Okay, sure. I think one of the things that really stuck out was the aspect of going to the poorest communities first. And I think we absolutely should go to the most disadvantaged communities. But I think we need to look at it from an outcome other than just, is there more money in this constituency X amount of years later? I think we need to look at outcomes like, are those regions, those communities now healthier, happier? Are they living with in a better environment? Is there less loneliness? Is there more community cohesion? So kind of, they sound like fluffy metrics to measure, but it can be done. And if you focus on those, it actually ends up having a compounding effect on things like the economy, the monetary aspects, etc. There's an international network or organization called the Wellbeing Economic Alliance, and Scotland is actually one of the countries which is working on this, where they basically are saying that instead of measuring a country's economy by its GDP or a town's community, etc., by its economic results, you actually look at other metrics like, have you reduced inequality? Are people living healthier and happier lives, etc.? So I would like to see some kind of like aspect of that brought into it. And then the other thing that I was going to say in terms of the leveling up aspect. Oh, sorry, I've lost my train of thought. Do you want to come in on what you were thinking, and then I will come back in a second?
Yes, I was just having a quick look at this wellbeing economic policy and this alliance, because there's an argument when we were looking, when the war in Iran started and people were thinking about what do we do, how do we react, a lot of the talk was around what are the markets going to think? What are the markets going to do? What are the markets doing today? And it was really bizarre how we kind of like value life and measure our decisions of how we do things through the lens of markets, money, like materialistic stuff, not life, limb, people's lived experience. Like the only thing that really matters, like, which is life. And I just thought that maybe that's the lens that we need. We'd probably get a lot more traction in social care if we had our leaders that were looking at the lived experience a little bit more and valuing that as a metric rather than what we focus on. And a lot of people I speak to are like, the only way we can get heard by politicians is if we say doing what we say will save you money. That's like the only language people talk. And it's quite interesting that the debate is now, from what the conversation like I had with him a few years ago, was about how it was about leveling up in the sense of looking at the poorest lives and their experiences and how to improve that. But what I found was really interesting was the way the discussion kind of he wasn't diverting it so much, but he was broadening it out a little bit. So he wasn't kind of getting into the nitty gritty of what goes on in social care and the operational side that I'm quite interested in. And we've just been talking about tenders and all like the practical stuff and housing. And he did touch on housing, but also talking about the other things that, are preventative, but they're kind of long term. So tackling poverty, obviously fantastic, and that's something that we need to do, and that will prevent more people needing mental health services or more people living without or not being able to live at home and needing having higher care needs. But it feels quite long term. I almost want to zoom in a little bit and say, okay, so what? Even the National Care Service, we've looked at it and we've seen how Scotland had to go through quite a lengthy process just to even get things changed on the statute books. So it's not looking like anything will change immediately from what he's saying, but there's an aspiration, and I'd be interested to see what would be changed tomorrow, next week, next month in social care that would affect social care. Is he able to tackle those issues? Anyone who can sit in a room with a bunch of people from the care sector, I'm talking about providers, managers, people with lived experience. If you can sit in a room with those people for an hour and let them talk at you and survive it, then you are a hero. But I'd like to see him and his team do that, really listen and take in the views and the issues, not necessarily from ADAS directors of adult social care don't necessarily know what the grind is on the ground. People who are actually living it and can then conceptualize that and think, what decisions do I need to make that will affect, how people are being assessed, how we're making the market sustainable, how people are able to access it. To be able to address those issues straight off, that is what I'd be interested in hearing about. And I didn't feel it come through in what he was saying to me a few years ago, and I wonder whether that will at all come out in his premiership.
Fingers crossed he's taken the last couple of years since that conversation to actually dive into the details and create more of a policy. I think I don't know how true this is, but one of the things I've heard on the various political podcasts, etc., that I listened to, is that he kind of wanted to come in after the summer, so he had a period of time to basically create the policies that he wanted and actually get into the nitty-gritty detail, so that when he then talks about them, he has a lot more substance behind what he says. But if he's going to be coming in July effectively, then he loses a couple of months to do that. So hopefully he's taken the time in the years preceding this to do so. One thing I was going to say just about what you're saying about the Iran crisis and how people are talking about markets versus reality, is that it's really important to remember that the markets are not the economy, right? The stock market can be doing fantastic, does not mean that the economy is. It's one of the reasons that we have such high inequality at the moment. But the other thing that I was going to say, and I only heard about this relatively recently, and I thought it was really fascinating, is that even the guy who created the concept of GDP as a measure said, do not use this to measure your national economy on an ongoing basis, because it only focuses on paid work and it doesn't focus on unpaid work, including caregiving. So that is caregiving for children, but also caregiving for any adult who, for whatever reason, needs care. And the vast majority of that unpaid care is done by women. So the literal person who created it was you need to talk about caregiving. So I think if we're talking about what are policies that could come into effect from day one and have a positive impact, it is making caregiving less of a gender issue and equalizing it, normalizing it, having more men talk about the fact that they are providing care to their loved ones, to whoever that loved one might be, whether it's a child, whether it's a elderly parent, whoever. And just normalize that caregiving is not something that only women do. And I think also that's one of the reasons that it's such a low paid sector, because as in social care as a collective, healthcare as a collective, when you have sectors that are predominantly dominated by women, you end up with a lot of people going it's not that important, or the work's not that hard, or it's not that necessary, and so therefore we don't need to pay them as much. And it's absolutely not true. Low paid does not mean low skilled.
So when I heard what he said about leveling up, I liked that he spoke about the workforce. And I just wanted us to talk about what the future of the social care workforce would look like now, especially with the COS, with the issue around the COS. So leveling up the care workforce. Sorry, Jazz, don't mean to digress.
No, absolutely digress.
To social care just for a minute, because I know we're coming to a close. And I really wanted us to talk about what leveling up the care workforce would actually look like, because right now, I mean, when it comes to, everyone knows that when it comes to the workforce, especially with social care, we have a serious problem that no one is talking about, which is who is actually going to deliver the work. So when he says leveling up the workforce, so what does that mean? Does it mean investment in more training? Where's the funds going to come from? So again, for me, it's what sort of conversation should we actually be having to sort of generate a bit more interest in this area? Because it's all well and good talking about the policies, but on the ground, as of today, there are carers right now that needs to be supported with more training. Well, actually, when I mean more training, I mean possibly more specialist training that can help them with earnings. Where's the funding going to come from? Because providers don't even have the funds. So these are the conversations I feel like we should be having, and perhaps even generating the content that would gather enough momentum for people. And like you said, Jazz, there isn't political will to make the changes necessary, but perhaps if we start somewhere, if we start from these conversations, then maybe we could get somewhere. And workforce is a major problem right now. So I would love to see how he addresses that. So when he spoke about leveling up and he made reference to workforce, I was hoping that would actually get into that a little bit more.
Yeah, I hope so too.
I agree. So let's hope we'll get some more of that detail, because like you say, where's the workforce going to come from? And there was just one thing that actually, you know, owed to Kat, who can't make it, bless her, is she mentioned something that made me think on LinkedIn when she posted something, and she said, yes, statistics from places like Skills for Care say that vacancies and staff vacancies, so the amount of vacancies there are for jobs has gone down, so there's more people in care jobs. That's always seen as a good thing, and I think sometimes that's interpreted as that is the sector doing really well because we're filling our vacancies, and we don't need as many staff. I don't know, but there's also, we do still need lots of staff. I think obviously that data is historic, so
especially management staff, I think.
oh my gosh,
yeah,
yes.
especially management staff.
Like the burnout rate of management staff is higher than it's ever been, and every year it just seems to get higher and higher. So if we're talking about workforce, I think like that needs to be an area of focus of like, how can we prevent that burnout, and then also how do we prevent people from leaving the sector? Because when we talk about churn, like there's the turnover that happens where someone moves from one social care provider to another social care provider, and then there's the turnover that happens when they leave the sector entirely, and we are losing all of that experience, knowledge, compassion. So I don't know the answer to that. But one of my questions about the vacancies is, and I don't know the answer to this, is one of the reasons that we have technically fewer vacancies because more care homes or more social care providers have closed because they're just not able to stay open with all of the increasing costs of
yes. So that was the end of her article. So what she posted was the fact that if you actually dig deep into the statistics of this, it's the fact that we don't have vacancies because we don't have as many care services, because people are going bust, or they're saying that they can't meet the costs of providing social care, or they're worried about it, and so they're thinking that it's just not worth our while. And it does make me reminisce about the live stream the podcast that we did, Obi. We were talking about the difficulties of a care provider staying open and the challenges that he had, and I think that's a real reality for a lot of people, and I think it's only going to get worse. It's a very strange market.
Because I also wonder sometimes where the data is gathered, because if we take a quick poll right now, I'm not sure who's watching, but if there are some care homeowners, supported living, social care providers here, I wonder how many vacancies they have right now. That would actually give us a true reflect from the sample size of the actual data. So sometimes when I see the numbers, I'm like, I'm not sure how you're gathering the data, but because as someone who works in the field, there is a lot of vacancy every single day. I get, OB, I'm looking for a registered manager. OB, I'm looking for someone to run my children's home. OB, my deputy's just quit, help. So I'm not sure where these data are being gathered from. So
yes, it is interesting. Any last thoughts before we close off? OB, have you got anything you wanted to reflect on from everything we heard from Andy today?
I don't know if there's anything I want to reflect on. It's more for me about looking to the future. I joined both yourself, Sophie, and Jasmeet in being excited about Andy coming in, because I'm hoping that he is going to remember the interview he had with yourself, Sophie, when he goes in there. and remember social care and make do on his promises as well. I mean, he has, I think, out of all the MPs, like you said, he's one of the MPs that actually speak about social care, so it's more of looking to the future to see what's going to happen for me.
Great. And Jasmine, did you have anything
else? Yeah, so in terms of Andy Burnham, I think at the moment it's quite easy to be hopeful because he's kind of a blank slate, so everyone can project their hopes and wishes onto him. I hope he does actually fulfill them. But what I would also say is that not everything needs to be or will be done by whoever is the Prime Minister. Like, we as individuals also have a huge amount of power, whether that's through collective action, collective organisation, grassroots community organisation. And it doesn't even need to be like politics directly. There is a book by Ruha Benjamin, I think is her name, called, it's either called Hope or called Imagine. I can send you the links after and you can add them to the notes if necessary. And she basically says that every system or institution that currently exists was imagined into existence by someone. So yes, some of them are incredibly oppressive, corrupt, like pick whichever word that you want, but someone thought of them. We are equally powerful of thinking of better ways of living, better ways of organizing, better ways of having community, and we are equally capable of trying to implement them. So I guess my hopeful aspect would be, yes, hopefully Andy Burnham will fulfill the promises that we want him to fulfill. But I also hope that anyone listening will also realize that they can themselves go and take action in whichever shape or form.
That's inspiring, Jazz. That's like a that's a, what I call it. It's a nice way to end Sophie, help me.
The segment.
It's the segment.
It's good. It's a nice way to just end.
I was thinking of something to say to tie all together. Yes, very inspiring, Jazz.
It is, and it makes me hopeful that that we can connect more with his team, that they'll be a bit more open, because I do feel sometimes there's a lot of gatekeeping, there's a lot of resistance to actually connect with the community, and there might still be, but the more you can get, because he's had so much time connected with the community, maybe he will encourage those around him to be more open to speaking to the ideas that you've been talking about, to the ideas that people have been putting in the chat. You know, just there's so much in social care that is ready to solve issues, and if they just invited us to the table and interacted with us a lot more, it would be better. And I don't know whether the report that's happening right now, I can't think who it is.
The Casey report.
Casey report, that's the one. I just wanted to say Penny Dash, but something else, a different one. And yeah, so hopefully I'm hopeful for that, because she's been talking to a lot of the part of the social care, but will the angle that she has to take be different?
So far so good, in my opinion. I know some differ. So
she's coming out with better stuff than she was before. I was worried she was going to blame the sector for its own problems at the start. I wasn't too sure where she was going with things, but I feel lately it's shifted. But I think her instruction comes very much, the framing of her research will come very much from whoever's commissioning it. So now it's not Keir Starmer. It may shift to be a bit more favourable to what truly is happening in social care, because I know loads of people have inputted into that. So like you say, Jasmine, we just need to keep on having a voice, talking. There's loads of ways to be involved. I know Kat's doing loads of stuff with Providers Unite, so people just need to keep on being engaged. But this has been really good, ladies. Thank you so much for this chat. It's been good.
Thank you so much for inviting me. I feel like I always learn so much whenever I come and talk to both of you, so thank you.
Thank you for joining last minute. Yes.
Absolutely, no problem.
All right then. Take care, everybody.
Okay. Have a great week. Bye. Take care.
Oh my God.